but it'll get me through 2 new patients. All right. Well, I am back. Haven't done a video for a couple weeks. I was out of town last week, and I don't remember what happened the week before that. Stacy doesn't remember either. Stacy's here with me. Basically, what I want to do today is in the comment section of the video, I have copied and pasted a email that was sent to me that is from a friend of mine, from a childhood friend, that went through and asked like the most basic, frequently asked questions when it comes to stem cell therapy and regenerative medicine. So this is the list of questions. They're listed down in the comment or in the description of the video. And what I'm going to do is just go through and answer these. And I've got Stacy is in here with me today because she wanted to hear what these questions were. So if I'm not talking to the camera, I'm talking to Stacy, and she's always good about giving me feedback. So that said, here are the questions, and my sister is always the first one to say hi. She's always the first. You can guarantee, like when I start a live video, doesn't matter what platform, it's always my sister that's there. Hi, Jen, love you. So, Jen, this is actually Lynn that sent me this, as in Lynn Wade. She sent me these questions. So, number one, what is stem cell therapy? Where do the cells come from, and how does it work? So, number one is 3 questions long, and this will take me the longest to answer this particular question because we're now into the 4th generation of regenerative medicine, and stem cell therapy is still like the catchphrase, but we've even moved beyond stem cell therapy, and you're going to hear what that means here momentarily. We still use it. We still use that term, but we're slowly pushing more towards saying regenerative medicine and instead of stem cell therapy. So regenerative medicine is basically products that you can use, whether from yourself or from donors, that can help reduce inflammation, control and modulate your immune system, and regenerate and actually regrow new tissue, versus standard medicine, which basically just throws medication at a symptom to reduce inflammation, but doesn't have any regenerative effect. So the 4 generations of regenerative products are these. Number one, there's PRP, so platelet-rich plasma. We do this here on a daily basis where we actually take people's blood, we spin that blood down in a centrifuge. The red blood cells sinking down to the bottom leaves us with that nice yellow stuff up on top. That yellow stuff is the plasma. That plasma is full of chemicals called growth factors and cytokines that can reduce inflammation and help to build the scaffolding that goes around the tissue that needs to be restored. So it's almost like a signaling marker for stem cells to come to that area and to regenerate tissue, and that's what the PRP does. So we put that in there with our injections because it can give a short-term, it gives a quicker pain relief. What's symptom? What's the word I'm looking for? Effect. And then when we use that in combination with the exosomes, we get a short-term effect from the PRP and then a long-term effect from the exosomes. That's why we do so well with those. Second generation would be using your own stem cells. That's where people will take stem cells from your fat tissue or from your bone. And I tell people that the more gray hair they have, the less likely it is to work because as you age, your stem cells become less and less effective. I still like your own stem cells better than I do some of the medication options that are out there, but it is not the most effective. The third comes down to stem cells. Did I define stem cells, or did I just skip right past that? So a stem cell is basically a blank slate cell that is your body's own natural reparative mechanism. So it's just a cell, and then your body uses that cell. It has an anti-inflammatory effect. It has an immune controlling effect. And then that stem cell can actually help produce and grow new cartilage in a joint. So that's what a stem cell is. So we get them from your body. But the older we get, the less likely that is to work for you. The third thing we started doing, and we did this for the longest, at least here, was umbilical cord stem cells, where they actually came right from the umbilical cord from donated from donated birthing material from healthy babies, for healthy moms, healthy babies. So we used to think that the stem cells would actually become the new tissue. So if you had like a bone-on-bone joint and you started growing new cartilage, we used to think that like the stem cells were actually turning into that cartilage. We now know that's not true. What happens is the stem cells release these chemicals to tell the body to produce more cartilage. So your joints are lined with these cells that are called, or inside of your bone, called chondrocytes. Those chondrocytes actually produce cartilage. So these exosomes that we're using are actually stimulating those chondrocytes to produce cartilage, and that's how we're getting the long-term effect. So that's the short answer to number one. That took about 7 minutes, but that's where the stem cells, what stem cell therapy, what regenerative medicine is, where they come from. The exosomes are actually still coming from donated birthing tissue, but we're actually extracting the exosomes out of the stem cells so they have that chemical effect on the joints to produce new tissue. Can your body reject stem cells? It can reject the stem cells. The most common reaction to that is just nothing happens. But now that we're not using the stem cells themselves, we're actually using the exosomes, then there is no reaction. There's no rejection reaction. It's the chemical messengers, it's not the cells themselves. So the process is actually, so number 3 is, what is the process? The process is actually pretty simple in that we sit down together with the patient and we talk about what their particular options are and let them choose what they want to do. And if they want to proceed forward with an injection, then we set them up with a nurse practitioner. They come in on the day of injection. The nurse practitioner sits down with them and goes through all the rest of the details, making sure I did everything I was supposed to do. And then we take their blood, do the injection, and send them home that day. So it's an outpatient procedure. It's very, very simple. You're going to walk out of here with just a bandaid. Stacy, you've seen that over and over again. How long does it take for the stem cells to do their thing and get results? So my standard answer to that question is still 6 to 8 weeks, because that's the expectation that I want to manage. Sometimes it does take time, but now that we're doing it with PRP and with exosomes, we're seeing more and more people that will actually see a difference overnight. But I still tell people 6 to 8 weeks, just so that they aren't upset if they don't get results for, if it doesn't start working for 3 weeks, then, I still told them, hey, it's 6 to 8 weeks. Number 5, are there any precautions you have to take after an injection? Yes, and that just all depends on where the injection is. So if it's into the muscles of the spine, then we want to look at, some lifting restrictions. If it's into a shoulder or a knee, we just want to make sure that they're treating that shoulder or knee appropriately. But it's not like after surgery where they have to be immobile. We want people to move. We want to just be careful with bending and twisting. And that takes us to number 6. What is the recovery time? The worst case scenario, so you get someone who's out of shape and right off the couch and we inject a knee. Worst case scenario is they have to take it easy for 6 to 8 weeks. And if they're right off the couch, then taking it easy for 6 to 8 weeks is not that big of a deal. We've had pro level athletes that get injected that got right back to it the day after. So that just depends on the individual. Number 7, how long does this process last? How long do these injections last? There are papers that suggest anywhere from 5 to 15 years. I never, ever tell people to expect that, because we don't know what to expect, because everyone's going to react to it differently. So there really is no hard and fast answer to that particular question. Number 8, does this cure the bone-on-bone, or is it a Band-Aid? Eventually need a replacement anyway. I will never use the word cure unless I'm reading directly from an email that I got from a friend. We just don't use the word cure. Yes, it can help people completely avoid knee replacement, but we're not going to use that particular word. So best case scenario is, they may never have to have it. And I always fall back on my dad's particular case, where he probably won't ever have to have a knee replacement now. He's doing awesome, and he's taking care of that knee, and he's out, he's active, and he's moving. So it could be a very, very much be just a permanent alternative to replacement. Number 9, what is the difference between stem cell therapy, stem wave therapy, and stem recruitment therapy? You gotten that one yet?
Nope.
Okay, so this stuff's out there.
Mm-hmm.
So when people start talking about stem cell or stem wave therapy, stem recruitment therapy, you know what they're talking about? Shockwave. Shockwave therapy is something that we use here in the office on a daily basis. It's very much like a ultrasound machine, other than it's not silent. It makes this pop, pop, pop sound. That sound wave is actually creating microtrauma inside of the body, and that microtrauma is actually working inflammation to recruit your own stem cells to come to the area to help help people to heal. That's cell recruitment. Some people call it stem wave therapy. So the difference is with stem wave or stem or I can't remember the stem recruitment therapy, you're recruiting your own stem cells to come to the area. It does take longer. It takes multiple visits versus if we just take a regenerative product like exosomes and put it into the joint, it's more of a, I'm not going to say quick fix because I don't want that to have a negative connotation, but it is a much quicker process. And here's a perfect example. We had an individual in here yesterday asking us about some scar tissue in his shoulder. Wanted to break down that scar tissue. And I flat out said, look, if we do an injection, it's almost an immediate result. We can get the same result using shockwave therapy, but it's going to take more time. And time was more valuable to him, so he wants to do the injection just to get that going. So that's the difference between those. And then number 10, now the most important, what will my friend or good neighbor discount price in the process? You know what we should do? We should just, like, since the boss is out of town, if you're listening to this video, you're watching this video, we will give you a discount. We just don't know what that looks like because the boss just left on vacation. So I have no problem doing that. So there's the top 10 most commonly asked questions that we got. I got that all in one email. So that's what I wanted to cover for you. If you get more questions, please feel free to put them in the comment section, and I will do my best to get back to those. So, all right. Thanks, everybody. Thanks for joining me. We'll see you guys next Tuesday on the next video. Thanks.